The Center of Excellence designation represents a collaborative effort amongst surgeons, nursing staff, various fields about the hospital with a team approach towards minimally invasive GYN surgery.
The designation as a Center of Excellence for minimally invasive gynecologic procedures is a very outstanding accomplishment that a hospital accomplishes by meeting a strict set of comprehensive standards set forth by the American Association of Gynecological Laparoscopists as well as American Surgical Review Board. I think it's important to remember that this hospital, St. Francis Eastside, was founded as originally the St. Francis Hospital for Women and Children. And women's health care has been first and foremost a primary concern for this facility, and I think that now is getting due recognition by the dedication the administration has shown, the dedication of the gynecologic surgeons, and the overall great care that they offer the women of this community.
It's a win for the patients. The recovery is so much faster. Certainly hysterectomies can be done through minimally invasive fashion. Virtually all benign hysterectomies can be done through minimally invasive fashion.
Some of the minimally invasive procedures that we do perform here at St. Francis Eastside now, we do hysteroscopies where we can take care of fibroids and polyps on the inside of the uterus. Patients go home the same day. We also do hysterectomies, and we can do those between 1 and 4 incisions on the abdomen, very small incisions. Patients are going home before lunch the next day and usually back to work within 2 to 3 weeks.
Minimally invasive surgery is still major surgery. However, with the smaller incisions and less invasive approach, the patients are out of bed quickly, they're back to home quickly. Most stay in the hospital less than 24 hours. Without that larger incision in the abdominal wall, the recovery is so much better. They can get up out of bed, they can eat, move around the room. It truly is much, much better for the patients.
I think the COEMIG designation will show the community that if they're considering gynecological procedures, that they certainly need to look at St. Francis as their facility of choice and look at the physicians that practice within that facility. The COEMIG designation will stand up against any peer group as far as showing the not just attaining this designation but maintaining this designation. There will be constant review not only of results but as new ideas come up, as new pathways are discovered, all of these will be incorporated into these centers of excellence.
It's really interesting how quickly this field has progressed over the past 10 or 15 years with the better optics, better lighting, better camera systems, better instruments. Of course, we had the robot Da Vinci system come along about 10 years ago. It's hard to think about what will happen over the next 10 or 15 years, but things that we thought would be impossible 10 or 15 years ago due to maybe suboptimal optics, and now is much easier with high definition, better technology. So there's been a lot of advances, and I suspect we'll be surprised at what comes out over the next 10 or 15 years.